Now we're going to talk about looking at the bones. This is a pretty big topic. There's actually a lot of anatomy that is covered in a non-contrast head CT scan as far as the bones are concerned. So realistically, we're not going to be able to go over everything. We'll stick to kind of the big picture concepts, and then we may have other videos that go over some of the other anatomy. But the bottom line is that you need a very systematic approach to make sure you don't miss any fractures, because some of these fractures are going to dictate management significantly. So it's important to be thorough and to kind of look at everything systematically if you can. Now, on that note, what I have here is I have my axial slices. This is actually thin slices on the bone kernel. These are, I believe, 0.625 millimeter slices. So, and then here, with my reference lines, I have my sagittal and my coronal. For the bones, we're actually going to look through in all of the planes just to make sure that we don't miss anything. And the approach that I take for looking at the bones is to separate things into quadrants, and then actually have a fifth section that I look at, which is kind of the central parts of the skull base, which we'll go over. But basically what I do is I look at the anterior structures, then I go right lateral, left lateral, then I go posterior, and then we'll talk about it. I'll go central. So what we can do is just start at the vertex, and we'll scan down just looking at the anterior bones, looking for things like fractures or lesions. As we scan down, we'll get the frontal sinuses. This is our opportunity actually to just systematically go through all the sinuses, starting with the frontal, and then we'll get to the ethmoid air cells or ethmoid sinuses here. And as we scroll down a little bit more, we have our sphenoid sinuses. And then as we go down, we'll have our maxillary sinuses. So you can just look here. One, look for any fractures that are bordering the sinus walls. Two, look for any opacification or pathology within the sinuses. So these actually look pretty clear. And as you get to the maxillary sinuses, if your scan goes low enough, you may get the maxillary portion of the teeth, so you can look at the maxillary teeth if that is included on your scan. Here we don't really get much of it, but just keep in mind that you don't want to ignore the teeth. Sometimes there is important pathology there too. And as we scroll up, we're still in the anterior portion. Now we can focus maybe a little bit more on the orbital walls, so we can look at the lateral orbital wall, medial orbital wall, sphenoid bone. We can look at that at both sides and just see, all the orbital walls that we can appreciate, medial, lateral, and just make sure that there are no fractures. Also on the bone window, we can just take a look at kind of orbits as well too, and just make sure there's no really dense foreign bodies like metal present. And we can come back up here, and now we can start transitioning over maybe to the right lateral side. So again, we start to the vertex, we'll come down, we'll start a little bit more anterior lateral. We can look again kind of at the orbital wall, but also as we come down here too, we're looking at the temporal bone. This is the squamosal portion of the temporal bone. We can come down looking for any fractures that might be here. And then also, we don't want to forget the zygomatic arch here. Can be a common place for fractures. So we're just looking all around very systematically for fractures. Here we have the ramus of the mandible process. We catch that on our scan, so we'll just look there as well too. And then as we come up, what we can do is take a look at the auditory canals. On this window, it can be really easy to appreciate, the external auditory canal, and then also the middle auditory canal. Here we have the ossicles of the middle ear. We can make sure that those are in the appropriate position. But then also as we look throughout the canal, make sure it's not impacted with anything. There's no foreign bodies there. Very naturally from that point, we can look at the mastoid air cells, make sure that they're not opacified with anything. We can look at the petrous part of the temporal bone here for fractures or anything like that, and we can come up this side. And then we can go over and do the same thing on the other side. So we can look kind of at the lateral parietal bone, the temporal bone here, going down into the squamosal portion of the temporal bone, looking again at the zygomatic arch on the left side, making sure there's no fractures, and then coming down here to the ramus of the mandible process, and we can go back up. And again, now we can look at the auditory canal, look kind of more into the middle ear, find our ossicle right here, ossicles of the middle ear, make sure they're not displaced. Can look at the mastoid air cells, of course, look at for any fractures, look at the petrous part of the temporal bone, kind of around this area, and make sure that there's no issues there. Now what we can do is, again, we can start at the vertex or from below, look at the posterior bones, looking for any fractures. We'll find the lamboid sutures here. We can appreciate them here, and as we follow up, they kind of come together maybe around here. This will separate, parietal, which is up here, from our occipital, which is now going to be down here bone. So that's an important landmark that can kind of help us figure out where we are. Looking for fractures, coming down, and then we come down that occipital bone, and we'll find ourselves here kind of at the atlas axis junction. Now this is, I kind of characterize as a central portion. After we look at the posterior bones, we can look here, the foramen transversarum. This is where the vertebral arteries will be. Depending on how low you go, you'll catch more or less of the cervical spine. So I think it's important to make sure there's no fractures that violate this space. That can be an indication to get a CTA of the head and neck. And then also we'll look here, this is the dens of the axis, make sure there's no dens fracture, make sure the atlas looks intact and their orientation is appropriate, and we can come up, and as we come up we'll catch the clivus here, and as we come up a little bit more, we still have, this is still our clivus, and now right next to the petrous part of the temporal bones, right here, petrous of the temporal bones, we have the petrous part of the carotid canal. So we can look all around here, make sure there are no fractures that extend into our carotid canals, because that will, of course, also be an indication for a CT angiography to look for vascular injury. And we can try to follow our carotid canals down and up and look for any other fractures kind of the skull base in this area. So that's a lot to do on the axials. If you see anything, and even if you don't, what can be really, really helpful is to look at the other views. So what we're going to do is look at our sagittal view here. And I think the sagittal view can show certain pathology very well. There may be certain fractures that you better appreciate here. But then also when you're looking at the cervical spine, you're looking at your atlas axis junction. You can just take a nice look here and make sure you're not missing anything. You just see the dens right there. Make sure things are lining up appropriately, and you can scan through, make sure there are no fractures anywhere that you didn't appreciate on the axial view. And then once we're feeling pretty good about that view, we can go to the coronal. Coronal is really nice for looking at the kind of orbital walls, floor, roof. There may be certain fractures that are a lot easier to see here, so important to take a look at the orbits. But then also some of the facial, like upper facial bones and skull base bones may be better appreciated here. And then also as far as your cervical spine. So you can make sure that the atlas and the axis are aligned, and ultimately that you don't have a dissociation of the spine and the skull. So that can be really helpful to just scan through quickly, make sure you don't see anything. And at that point, I know that's a lot, but as you do it, you'll get more comfortable going through your search pattern. But at that point, you've done a pretty good job of looking at all of the bones and all of the orientations, and you're ready to move on to the other parts of your search pattern.